Good morning, class.
Good morning.
So before our class, let's take some time for our class affairs. So Christmas is approaching, and we want to be a part of the talent show.
But what can we do then?
Okay, so it's an important question, and it depends on your ability. Just like having some magic trick, or singing, or dancing like that.
Hello, are you okay? You okay? Are you okay?
Hello, Dr. Parker.
Hello, Maya. How are you?
I'm fine, thank you.
Please have a seat. What brings you to my practice today?
Today I wanted to have my annual flu shot. And how about you, doctor?
Oh, I'm fine. Thank you for asking. It's a bit stressful lately, and sometimes it's difficult to fall asleep. I have a bit of insomnia, but in all, it's okay.
Insomnia. Do you go to the doctor because of it?
No, I didn't go to the doctor because of that, but I think it will be fine. I'm used to the stress, and yeah, it's okay. I think it will be okay. So you're here for your annual flu shot, right? So, okay, Maya. So, are you ready for your shot?
I don't know. I just kinda don't want to do it.
So, don't be scared, Maya. We will bring it behind us in a second. It's just a small prick, if that's okay.
Sure.
Oh. Here we go. Very good, Maya. You're very brave. That's it.
Thank you, doctor.
You're welcome. Okay, so nice job, Maya. You did very well. And it might be that your arm might swell a little bit. And in this case, just take it easy. Don't do rigorous exercises. And yeah, it will be fine.
Oh, thank you, doctor. Thank you for your patience.
You're welcome. That's my job.
Thank you.
Oh, have a nice day.
Okay, thank you.
Bye.
Bye.
Okay.
Where am I? It hurts.
Good evening, miss. Good to see you awake.
Hello, doctor. Why am I in here, the hospital?
Well, you fainted during the class in school and got admitted to hospital. And
What's wrong with my report?
we have noticed swollen lymph glands, mainly on the neck. So we ran a full blood test in order to investigate the cause. And here's the report, you can see.
Oh, I've noticed that too. I've just feel headache and like some diarrhea and maybe sometimes some muscle and joint pain too. Is it related to it?
I'm sorry, miss, but unfortunately after the blood test we find out that you tested positive for HIV. And the symptoms you've just mentioned are actually typical symptoms that would occur on HIV patient.
What? No, impossible. What's HIV? I've never been to bar, been to drink, or slept with anyone.
Calm down. I'm so sorry about
But
that.
impossible.
But it's true. Sorry. I'm really sorry about that. So if you want, I can show you the blood test if you want.
I don't know what blood test. I will never have HIV.
I'm so sorry. But unfortunately, it's positive. So, yeah. I'm really sorry.
Why? My life is ruined. How should I do? What? do? I've done nothing. I've done nothing. Right? Why would I have this disease? You can get HIV if you have anal sex with someone who has HIV without having protection. That's definitely not me. That's not my case. Next. You can get HIV if you have vaginal sex with someone who have HIV without using protection. That's also not me. I have never have sex with anyone. HIV can be transmitted from a mother to her baby during pregnancy. No, my mom don't have it. You are at high risk for getting HIV if you share needles, syringes, or other drug injection equipment. What if Dr. Parker and her insomnia? Oh my god. Is it possible that Dr. Parker is actually confused the needles and while we're talking to each other? Oh my god. I can't believe it.
Good morning, everyone. So thank you for being here today. It's my pleasure to know that all of you today have the courage to come here and to share with us your own experience. So I know that living with HIV is never a simple task. I know some of you may experience some of the hard time that you find it very difficult to get through. But I think today is a great opportunity for all of us here today to share our own experience. So anyone would like to start first?
Me.
So I can start.
So I actually encountered a lot of misunderstanding about HIV while I was going to work.
And as soon as my colleagues discovered my condition, they started to treat me as like I was incompetent.
I was feeling very frustrated about being isolated and also seeing the discrimination firsthand. But I think they did it out of malice.
And as soon as I start educating them about this condition, they start to treat me normal again.
I have similar experiences as you, and I have faced some discrimination in hospital. And I was so surprised because they are medical professionals and they should be supporting us. But instead, they treat us with caution, like wearing masks and keeping social distances. And it was so heartbreaking to see that the one who should be helping us and should treat us like a disease or like.
It's okay. Just take it easy.
Absolutely, I agree with you. I'm so angry that people stigmatize HIV. You know, when I told my boyfriend that I had HIV, I was so scared and shocked that he was gonna leave me. And when I was home, I had to grip the reality of telling him. But now, we're gonna engage next month. It's actually surprising how people can be open and accepting about HIV.
I've got a question.
Yes.
So, do you think you would infect your boyfriend?
No, actually, you can still have sex with HIV. Even sometimes you can even have unprotected sex with your boyfriend, with my boyfriend when I have HIV.
Really?
Yes. There are steps you have to take though. The personal treatment I use is ART, antiretroviral therapy. It prevents the HIV from damaging your immune system. It actually lowers the amount of HIV in your body.
Wow.
Sometimes it gets so low, it's undetectable, You can even have unprotected sex sometimes.
Oh wow!
Yes, but it might take 6 months for the treatment to work, and you have to do a blood test every 3 or 4 months. But even if you are HIV positive, you might still get other strands of the virus, so please be careful and protect yourself.
Oh, I didn't know that before, and thank you so much for your sharing. I've actually got HIV for over 1 month ago, and I was just lying on the bed and don't know what can I do. And after listening to all of your stories and your experience, I feel so obligated and encouraged. And I think you urged me to share, not only to inform myself, but also to share your experience and also myself to others who, like my students as being a teacher, to inform that about these things that are unknown to them.
Maya, that's so courageous of you. How about we start by educating the classes about HIV and start promoting awareness of it?
That's an excellent idea. Maybe we can present it to our students.
Great, let's do it.
Yeah. Okay, Maya, you can do it. Okay, sit down. So, good morning, class.
Good morning.
So, today we're going to discuss a very unusual topic, which is, maybe you guys guess it?
What is it?
HIV.
Yes, HIV is a very unusual disease, and to be honest, in the last few weeks, I've gone through a very tough days, and in short, I've diagnosed with HIV. Yes, so that's why I've went to a very encouraging support group, and after listening to those experiences and thoughts about our guest speakers, I feel so encouraged. And so I've invited some of them to share their thoughts with you guys and have a talk with you, and let's see.
HIV stigma is rooted in the fear of HIV. Many of our ideas about HIV comes from the HIV images that first appeared in the early 1980s. There are still so many misconceptions about how HIV is transmitted and what it means to live with it today. The lack of information and awareness combined with outdated beliefs lead people to fear getting HIV. Additionally, many people think of HIV as a disease that only certain groups can get. It is, for example, a myth that HIV is a gay or LGBTQ disease. However, in reality, anyone, regardless of their sexual orientation, gender identity, gender expression, or other factors, can acquire HIV. Calling it an LGBTQ disease is just medically untrue and only creates harmful stereotypes about people living with HIV and the members of the LGBTQ community. Another myth is that people will get HIV if they have sex with someone who is living with HIV. There are many ways to remain HIV negative if you have sex with someone living with HIV. For example, usage of condoms is one of the most effective ways to prevent the transmission of HIV during sex.
Hello everyone, I'm the consultant from a HIV support group. So today I'm going to share some of the HIV information to all of you today. So firstly, it's very important for you to use the water-based or silicone-based lubricant in order to prevent the condoms from breaking. Furthermore, you should not be afraid to get tested. It's the only way that you know you or your partner have HIV or not. So just consider maybe getting tested together. And then if you're unfortunately just infected with the HIV, you can just consistently taking medication such as ART. So it is able to lower the amount of HIV in your bodies. So sometimes the ART just works so well that the test cannot find the HIV in your blood. It means that you cannot affect anyone with HIV through the sex. But just know that it may take 6 months for ART to lower your virus level enough to for you to make a unprotected sex safe. So also you need to have a blood test every 3 to 4 months. But if you are HIV positive, you can still infected with a different strain of virus. So definitely protect yourself, okay? So another thing we'll be talking about the transmission of HIV. So many of you may know that the anal sex is the riskiest type of sex for getting or transmitting HIV. But you need to keep in mind is that if you have a vaginal sex, it doesn't mean that you will not have the HIV. It is also, you can also have get HIV if you have vaginal sex with someone who have HIV without using any protections, you know. So HIV can also be transmitted from a mother to her baby during the pregnancy. If the mother have HIV, it's called the mother-child transmission. So it's very usual that the transmission, it's very usual that students may misunderstanding the transmission chain can be maybe just the anal sex. I will have the vaginal sex, then whether will I get infected or not. It's not the case. So just know more about the factor about HIV. So that's all. Bye bye.